Gaming addiction is now categorized as a mental health disease, and related industries are already clashing over the new guidelines, which countries are set to implement from the year 2022. Our Won Jung-hwan has the story.
The WHO's decision-making body has included gaming disorders in its international classification of diseases, along with other disorders such as gambling, amid growing global concerns about gaming addiction. The medical sector defined the disorder as a pattern of gaming behavior characterized by impaired control over gaming, to the extent that is evident for more than 12 months and results in significant impairment in personal life, family life, social life, education, occupational activities, or other important areas.
Of course, we cannot diagnose that you have a problem for just a day or two, weeks, or even months. We see this as a disease for those who are suffering for more than 12 months.
The medical industry in South Korea is welcoming the WHO's move as it could help health professionals prevent and treat the problems stemming from the disorder, in the country known for being a gaming powerhouse.
According to recent research, there are some 20% of people in their 20s to 50s who are actively playing games. So far, there is a lack of evidence for a specific drug or a specific program to effectively support them if they need help. That is why we need these clear new guidelines, so that we can engage in clinical tests and active health-related research.
But the gaming industry has been opposing the WHO's move, saying it will harm the industry. The industry claims the new guidelines will cause a loss of over $9.2 billion and 20% of the industry's jobs within 3 years of their implementation. The industry also claims that the move will deprive children of their rights.
We are concerned that teenagers will feel a sense of guilt when playing video games. They have the right to enjoy their gaming culture. We feel it is unfair to categorize some teenagers by certain criteria which are very unclear diagnostic measures.
In response to the WHO decision, a committee made up of over 80 organizations from academia, labor unions, and game associations highlighted Article 31st of the United Nations Convention on Rights of the Child and claimed that the decision will cause more social problems.
Parents will be extremely afraid of their children playing games. They will always feel worried that their kids could have the disease. This will result in a big social conflict between children and parents.
The committee plans to hold a press event on Wednesday at the National Assembly to outline its upcoming moves against the WHO decision, raising further concerns that the gaming industry and medical sector are set for more clashes in the future. Won Jung-hwan, Arirang News.